According to a new report, death rates among the most common forms of cancer are dropping here in the U.S. The report found a decline in deaths among both men and women across all racial and ethnic groups. The report was released by several of the nation's top health organizations. The data covers trends prior to the coronavirus pandemic. For more, I want to bring in Dr. Dax Kurbegov. He is the Vice President of Clinical Programs and Outcomes at the Sarah Cannon Cancer Institute. Dr. Kurbegov, thank you for being here. So starting off from the beginning, just tell us what types of cancer we're seeing fewer deaths in and how these numbers compare between men and women.
Yeah, thank you for having me. I think this report is good news for the community at large. What it demonstrated was a reduction in the cancer death rate for 11 of the 19 most common cancers in men, 14 of the 20 most common cancers in women, and really leading the way, the most striking results occurring in lung cancer, which is the most common source of cancer death in our society, and melanoma, which is a type of skin cancer.
All of this sounds like fantastic news, and it coincides, of course, with new treatments for different cancers that have been approved. Do you think that these have had that type of a positive influence on these improved outcomes, or are there other factors that you think are really affecting these results?
Yeah, that's a great point, and I think that the latter is true. There's progress on multiple fronts. We're seeing a reduction in lung cancer related to fewer people smoking. We're seeing earlier detection of cancers because people are being screened more frequently. And really important in the last 10 years has been progress made in treatments, new types of treatments, including immunotherapies that unlock the power of the patient's own immune system, and targeted therapies that can be given in very personalized ways are translating into better survival, better quality of life, and overall better outcomes.
Dr. Kurbegov, you mentioned earlier screening, and as I noted in the introduction, the study uses pre-pandemic data. So I'm wondering, is it possible that what we've heard from people, that people during the pandemic have put off routine screening and in some cases even treatment? Are you concerned that the gains that we see in this data might in fact be reversed by the pandemic?
Yeah, that is a real concern, and I'm so glad that you raised it. There's simply no doubt at this point that during the height of the pandemic and for a period of time after that, we saw a really dramatic reduction in cancer screening activities. That has all of us worried that there is the potential for cancers to go undetected for a longer period of time. Cancer screening is critical, and if there's a message to get out to the community at large, it's please talk to your primary care physician, re-engage in wellness visits, get those cancer screenings done, because those allow us to identify cancer in its earliest stages when it's most likely to be curable.
You know, for all of this really good news, and we do want to celebrate the good part of this news, the report also mentions how progress has stalled for some of the most deadly forms of cancer, even noting an increase in deaths from some forms. Which cancers do you think that scientists and researchers and all of us in the public need to focus greater attention on?
Yeah, that is the dose of reality that comes along with this. And specifically, we saw some decrease in the rate of decline that we were seeing in colon cancer and female breast cancers. We also saw some increase in the death rate of cancer related to brain cancers and certain cancers that are specific to each sex. In men, it was oral cancer. In women, uterine cancer, liver cancer. These are areas that merit ongoing research. There is, and the authors note this in the study, a real concern that the obesity epidemic in the U.S. is contributing to some of these increases in cancers. There are many cancers where obesity likely plays a role in increasing the risk of that cancer.
Well, all important information and an important reminder for all of us that have put off those routine well visits to do so. Dr. Dax Kurbegov, thank you.
Thank you.